Hi guys. This is my second go at doing the video. I was way too long the first time, so I'm going to abbreviate my slides. But I did pain management and palliative care. Um, so working in pain management and palliative care have some differences with other areas. And I know I was confused between like hospice and end of life and those things, but here I've given some definitions of palliative care. This one, the third one, I like the best. Patient and family centered care that optimizes quality of life by anticipating, preventing, and treating suffering. Palliative care throughout the continuum of illness involves addressing physical, intellectual, emotional, social, and spiritual needs and to facilitate patient autonomy, access to information, and choice. Um, so you guys can read through these other ones. One thing to remember is it can occur along or separate from a curative illness or a life prolonging care. So it can be either. It doesn't have to be like a quote death sentence disease. It doesn't replace current care, but it coincides with it, works together with the medical team and treatment team. There's no time limit on it, as there is with hospice, or most cases with hospice, I should say. Um, there is a shift of search for a cause and a cure to management of pain. So that's another individual aspect of palliative care. It can be prior to patients ending hospice, and oftentimes a social worker will be the one to refer to hospice care. Pain management piece, it's fairly new. Also, pain, it can either be chronic or acute, like an injury or something like that. Um, so, trying to summarize which things are most important. Pain in itself can become an illness to patients because it just takes over and it creates many losses for patients, such as not being able to dress themselves anymore. The two challenges I chose were just treating the multi dimensions of client care, the biological, spiritual, emotional, financial, social, and psychological. Those are all core elements. And I'm not going to go through all of these, but you want to think about principles and values, community and family, educating physicians, use of empathy. The second one I chose is pain management. As I said, it's relatively, it's not a common specialty area. Um, Oftentimes patients aren't receiving adequate pain management. It's subjective. It's like not a black and white area. Um, Definitely more discussion needs to be done as far as pain. But quality of life is very important and the comfort level. Challenges, um, or addressing the challenges, sorry, following the code of ethics. There's even one for palliative care, evidence-based therapy, um, contributing to healthcare reform, communicating with between interdisciplinary team members, and acting as a patient or family navigator. Um, Supporting patient with their goals for the future and their wishes. Um, Attending public education forums, maintaining autonomy, and teaching the medical staff the importance of that. Increased conversations, hospice team collaboration, and ability to cross disciplinary lines. Resources. Um, Again, there's like a whole section of the biopsycho social and spiritual evaluation that can be used. Um, the standards of social work practice in palliative and end of life care does exist. Um, time in team meetings, assessments, translation services, knowledge of substance abuse, access to medical records, and then just having accessing literature on medical terminology, interventions, doing the proper assessments, knowledge of the physiological aspects of symptoms and illness, family histories, observations of patients, pain levels, their vitals, learning all that, connecting patient and family with community services. Um, Patients, the resources they need, coping mechanisms, counseling, family counseling, education, advanced directive information, spiritual care, all important. Here's two websites to give you additional knowledge. Social workers, they should have knowledge of other cultures, religions, and ethnic backgrounds, of course, communication skills, collaborating with others. Um, Sorry, it got um, any knowledge of all illnesses, any illnesses, symptoms is important. HIPAA laws, knowledge of preventative medicine, ability to understand and translate medical terminology and explain it to your clients, leadership abilities for when you're in team meetings, um, and have some sort of foundation in pain management. And here are my references. Oh, wow. Okay. Yeah, I cut my presentation like in half. So that's really it. I will post my question to you guys in the discussion area, and I hope I didn't sound too rushed, but I was kind of panicky after the first one. So I can't wait to see everybody else's presentations. Bye. Uh-oh, I can't stop it. Okay.